Dean Goldstein, Associate Dean Sikansky, faculty, staff, graduate nurses of the LaSalle University Achieve Program, and family and friends of graduates. Thank you for inviting me here this evening to share some thoughts on becoming a nurse. I began taking prerequisites for nursing school when I was 17 years into my career. I had been working in quality and safety at Thomas Jefferson University Hospital for 7 years, and for 10 years prior to that, with companies developing and implementing decision support systems for healthcare organizations. I was fairly well paid. I was a wife and mother of 2 children. I loved my work, but felt I could be better and contribute more if I knew firsthand what it was to practice as a clinician. I matriculated in the Achieve program in September 2008, and so it began. I was not sure if I was up to the challenge of being a nurse. I'm needle phobic. I almost fainted in the PACU after my son had his adenoids removed. And as my dad often said, I have no emotional insulation. My first clinical was at Presbyterian Hospital with Sue LaSalle from LaSalle. I fell in love with patient care that semester, and more so every semester thereafter. That said, there were many nights I came home from my clinical day thinking, there is not enough wine in this house. I cried for 24 hours after completing my last clinical day at HUP. I've never been a runner, but as I came off the floor that day, I thought, this is what a marathoner must feel crossing the finish line. I was not sure at first if I would attend graduation. It would, after all, be my 3rd. But my husband and I decided it was important to have our children graduate along with me. We had all sacrificed, and it was a family achievement. There were many activities in their lives I had missed, but I hoped that they learned through me that education is a lifelong pursuit. Graduating from the Achieve program was one of my proudest moments because it was shared with my children. So, congratulations to you and to your families who supported you on this journey. And share with you tonight this tremendous accomplishment. I know that the days ahead will be filled with angst over passing the NCLEX and finding a job. I wish you the best of luck as you continue to prepare to test and interview. I encourage you to have patience with yourselves. One of the best cliches in existence is if it's meant to be, it will be. The close second is, life is a journey with problems to solve, lessons to learn, but most of all, experiences to enjoy. Try to enjoy the experience of becoming a nurse. All experience has to start somewhere. As new graduates, we are novice nurses. If you are like me, in your early days on orientation, you will find yourself thinking, how did I even graduate from nursing school? I don't know anything. You will be focused on tasks and managing your time. You will be often so focused on tasks, you will become senseless. You will believe the monitor when it says your patient's pulse ox is 70, even though she is eating a cheeseburger, talking on the phone, and is in the hospital for cellulitis of her foot, and her respiratory status is totally unaffected. Let yourself be a novice. Don't be embarrassed by what you don't know. Admit it, ask questions, embrace your preceptor, be humble, and be open to learning. The last stage in Pat Benner's Stages of Clinical Competence is expert. The most striking part of her description of the expert phase of clinical competence is this. The expert operates from a deep understanding of the total situation. His or her performance becomes fluid and flexible and highly proficient. Highly skilled analytic ability is necessary for those situations with which the nurse has had no previous experience. Wow. Even as expert nurses, we are presented with situations in which we have no previous experience. Medicine and nursing as disciplines are often referred to as practice. As such, we are faced with the humility of never being beyond the point of learning and embracing the fact thereof. For new nurses, I offer the following advice. Don't rely on technology or technologists. Take every opportunity to do a hands-on assessment. Count heart rates and respiratory rates with your watch and your stethoscope. Listen to heart, lung, and GI sounds for a full minute or more to appreciate what is normal for each of your patients. Take advantage of helping a patient with a bath so you can perform a head-to-toe assessment. Take the time to know your patients. Use technology for confirmation of your observations, not as the source. Technology is an adjunct to clinical practice. We need to rely on our own practice first. Never stop practicing. In 1994, Kenneth B. Schwartz, a successful 40-year-old healthcare attorney in Boston, a father, husband, brother, and son, was diagnosed with advanced lung cancer. For 10 months, he underwent treatment, including radiation, chemotherapy, and surgery before losing his life to the cancer. He wrote about his experience in an article for the Boston Globe magazine entitled A Patient's Story, and I quote, "And yet the ordeal has been punctuated by moments of exquisite compassion. I have been the recipient of an extraordinary array of human and humane responses to my plight. These acts of kindnesses, the simple human touch from my caregivers, have made the unbearable bearable. While doctors managed my medical care, my day-to-day quality of life and comfort were in the hands of 2 or 3 nurses." We, as nurses, are privileged to be present, actively present, during the most joyous, scary, devastating, sad, and vulnerable moments of life in a way no other is. We are present through labor and witness the miracle of a new life coming into the world. We are present when our patients hear the devastating news of a new diagnosis. We are present when our patients transition from this life into the next. We are present to give medications, feed, toilet, and bathe our patients. I remember, as a very new student nurse, caring for an elderly, proud, and just a little bit cranky older woman with COPD. Midday, I helped her to get cleaned up for an afternoon visit with her daughter and granddaughters. While she was looking forward to the visit, she was disgusted with how her hair looked, for she was a woman who regularly went to the salon to have her hair trimmed and set. As you probably know, it isn't easy for a person on oxygen to wash her hair in the hospital. At any rate, I went into the supply room and found they had a microwave no-rinse shampoo cap. I was positively giddy as I heated up the cap in the microwave and proceeded to her room to wash her hair. She hummed as I massaged the warm cap on her head and dried and fixed her hair. Her daughter and granddaughters came, and she looked so nice with her clean hair and just a little bit of lipstick. When I was leaving, she gave me a big hug and told her daughter and granddaughters what a great nurse I was. On the spectrum of skills we require as nurses, this one is not the most highly technical, but I learned that compassion is a skill as important as any other. In having her hair shampooed, she felt less like a patient and more like the person she was. As a nurse in the pediatric intensive care unit at CHOP, I was assigned to care for a 17-year-old man who had been diagnosed with brain cancer a year earlier. He had had the tumor resected, had undergone radiation and chemo postoperatively. As with many brain tumor patients, he suffered side effects of the radiation during and after the treatments. But he recovered enough to return to school and even went to Spain on his last trip, a goal he held on to throughout his treatment. Shortly after his triumphant trip, he had a worsening of symptoms. He was admitted to the ICU and underwent an urgent MRI. On recovering from sedation, his aunt and uncle arrived for a visit and brought him Thai food from his favorite restaurant. His mom had to help him to eat, but he enjoyed the food and the company. His aunt and uncle left, and in the late afternoon, I was in his room taking his vital signs. He was asleep, tired from the sedation, the stress, and the disease. The doctors came quietly into the room with the results of the scan. They told his parents that the tumor growth was causing his brain to herniate. He was the oldest of 4 children. He was a good student, an athlete, a son, a brother, a grandson, a nephew, a cousin, a friend. His parents asked if I would stay with him in the room in case he woke up while they went out to the family lounge to cry, to call his grandparents, to talk with social work and child life about how they would tell him and his siblings. When he woke, I chatted with him for a few moments and then called his mom to let her know he was awake. I will never forget the look on his parents' faces as they came into the room, knowing they had to tell their 17-year-old son he was dying. I left the room to give them privacy. I went to talk with social work and child life about the plan for his siblings who would be there shortly. It was the hardest and saddest shift I've worked as a nurse. He was discharged from hospice the next day, and I checked the newspaper periodically in the next few weeks until I saw his obituary. I readily admit I shed tears for the children. That night, in preparing these comments, and obviously here with you tonight, but what an awesome thing. How lucky am I to have a job that in this case allowed me to feel tremendous grief, but in many others, tremendous joy. Every day is a privilege. Back to Kenneth Schwartz. Just days before his death, Mr. Schwartz founded the Schwartz Center. A center he envisioned would nurture compassion and healthcare, encouraging the sorts of caregiver-patient relationships that made all the difference to him. Schwartz Center Rounds is the focal program of the center. Rounds allows doctors, nurses, and other caregivers to come together on a regular basis to discuss the most challenging, emotional, and social issues we face in caring for patients and families, and to focus on the humane dimension of medicine. Rounds are held in 350 hospitals in the U.S. and in many of the hospitals in our area. When you begin working, I encourage you to find out if your hospital has Schwartz Center Rounds and find the time to attend. If your hospital does not have rounds, find a way to take time to reflect regularly on the privilege it is to be a nurse. I leave you with these words from Rose Walden. I think they powerfully speak to the honor and privilege of being a nurse. It is something to be able to paint a particular picture or to carve a statue, and so to make a few objects beautiful. But it is far more glorious to carve and paint the very atmosphere and medium through which we look, which morally we can do, to affect the quality of the day that